Now, the nasal involvement of the HIVs, what different features are present in the nasal area. First, the herpetic lesions of the nose. Herpetic lesions of the nose develop due to herpes virus. Recurrent sinusitis is very common in the nose. Burkitt lymphoma. Burkitt lymphoma is a type of lymphoma that involves the B lymphocyte, and it's a kind of the non-Hodgkin lymphoma. So it's also present. Chronic sinus infection, fungal sinusitis, Kaposi sarcoma, as I mentioned, so it involves the ear, it involves the nose also. So all these are the different lesions which are present in the nose, and also different infections which are usually maybe not as troubling, but once the immune system is weak, then they become really troublesome.